NAPLEX video number 8! Woo! Yay! We're talking about peripheral artery disease today, or PAD. P-A-D. What is it? Non-cardiac systemic atherosclerosis. It mostly manifests in arteries in the lower extremity, but may also present in the carotid, mesenteric, renal, brachiocephalic, and subclavian arteries. Risk factors: hyperlipidemia, diabetes, smoking, and hypertension. Presentation: intermittent claudation. What is that? Or symptoms during exercise. So you can have fatigue, pain, discomfort, cramping, numbness in the buttocks, thigh, and calf upon exertion, and it's relieved with rest. Resting limb pain or non-healing wounds and gangrene are more severe versions of peripheral artery disease. There's classifications: atypical leg pain, classical claudication, and then critical limb ischemia. Diagnosis: you can use an ankle brachial index or an ABI. If it's less than or equal to, less than or equal to 0.9, then you have peripheral artery disease. You can also do a treadmill ABI, an ultrasound, a toe brachial index, and an angiography. Treatment: initially, you use exercise and rehab, basically, and control comorbidities and risk factors such as smoking cessation, diabetes management, antihypertensives for hypertension and peripheral artery disease, lipid control with statins, and the annual flu shot. Revascularization: this is done when there's limb-threatening ischemia, so when there's rest pain, ischemic ulcers, or gangrene, or if there's inadequate response to rehab and meds, or a significantly disability due to the intermittent claudation. Pharm treatment: the basis is antiplatelets to reduce stroke, MI, and vascular death, statins, diabetes meds, hypertension meds, specifically ACE inhibitors, xylostazol, and anticoagulation for those with acute limb ischemia with heparin. So aspirin is 75 to 325 milligrams a day. It inhibits platelet aggregation by irreversibly inhibiting platelet cyclooxygenase, preventing the production of TXA2. Side effects: GI upset, GI bleed, hematologic side effects, tinnitus, bronchospasms, angioedema, and Reye syndrome. Or you can use clopidogrel if you have an aspirin allergy, 75 milligrams once a day. It inhibits platelet aggregation by selectively and irreversibly inhibiting ADP to its platelet receptor and the subsequent activation of ADP-mediated glycoprotein GP2B3A complex. That was a mouthful. Side effects: chest pain, hypertension, rash, constipation, diarrhea, headache. Ticlopine is not recommended, so we're not going to talk about it. Xylostazol, it's a PDE3 inhibitor, or a phosphodiesterase inhibitor. I don't know what phosphodiesterase, forget that I said 3. 100 milligrams twice a day. You need to take adjustments when taking diltiazem, ketoconazole, erythromycin, omeprazole, 3,4-A, and 2C19 inhibitors. It's a cyclic AMP is increased, leading to irreversible inhibition of platelet aggregation, vasodilation, and inhibition of vascular smooth muscle cell proliferation. So that's its mechanism of action. Side effects: dizziness, headache, palpitations, abnormal stools, diarrhea, rhinitis, infection, edema, nausea, abdominal pain. Precautions with platelet aggregation inhibitors: thrombocytopenia, creatinine clearance less than 25, and hepatic impairment. There's a black box warning for heart failure, so don't use it in heart failure. Contraindicated in heart failure, hemostatic disorders, and bleeding. Then there's another drug called pentoxifylline. It's not used for peripheral artery disease, but people have thought that it could be. It's actually used a lot in wound care. I did a wound care rotation and we used pentoxifylline for it. But anyway, it reduces blood viscosity via increased leukocyte and erythrocyte deformability and decreased neutrophil activation. So basically, it deforms the leukocytes and red blood cells, so it improves tissue oxygenation through enhanced blood flow, so it gets to the site. 400 milligrams 3 times a day with meals. Side effects can cause some GI upset. So that is peripheral artery disease. Next is arrhythmias. Can't wait. Catch you on the flip side.